everybody. Welcome back. We are here. Oh, wait, first, this is Opria's open mic. Let's go.
Welcome back to the episode 7.
And
I'm going to get you to say the one day.
You're never because it's dumb.
No.
But I have a very special guest here with me today. You guys have heard me talk. If you're following me on social, you've seen me talk about it a million times. It's Kenny. He is my PT. He has saved my life through my million knee surgeries. But not only that, now I go to him like we're years later.
It's like maintenance.
But yeah.
I get really tired. Like
we have maintenance.
Listen, I need the ratio of people saying how good looking Kenny is and if he's single to shift from Kenny to me. I'm in these videos too. And
Everyone's
she goes
like,
once
so
a week
hot.
to Kenny and then you get all this feedback. I need some love. So okay, put it in the comments.
I mean,
John,
his
wow, you're looking
biceps are
great.
bigger than my quads. I get that all the time. Like when we do a video, they're like, "Whoa, my gosh, look at his body." I was like,
yeah. He's taken. He's married,
happily married to
7
an
kids,
awesome wife.
6, 7 8 kids, I think. 4
Four is
kids.
enough.
Yeah.
But
I don't need more.
Kenny owns MPower here
One of the
in
owners,
yes, in Nashville.
Do the other owners
in the
matter,
surrounding
Kenny?
area.
The other owners aren't on our podcast. The other owners don't
true.
matter.
There you go.
I'm the one representing today, so
there you
that's
go.
right. I'll take that. I'll take that.
But he seriously has changed my life, Kenny. Like all the things that you've done, not only with all the stuff I went through, but now just trying to keep me from getting injured.
It's incredible,
kind of
actually. Like her mindset when she comes back, her
I was
body
like,
when she
I
comes
feel so
back.
much better.
Thank you.
Well, thank you for saying that. That's always good to hear stuff.
But so many people have questions because we're all getting old. We've had a million injuries. You've had a million injuries.
I have the first question.
Okay.
Okay. So one of the things that Erin has gone to you for a while now, okay, is to use a special treadmill.
Yeah.
Okay. And tell me about that treadmill a little bit. What's so
Ultra
special
G?
about it?
Yeah.
Ultra G is it's a gravity reducing treadmill, basically. You get in this treadmill and it has like this bubble around it.
Okay.
Fills up with air, so it unweights you.
Oh.
So you can go down to like 20% of your body weight.
Okay. Because she keeps
kinda
coming back and she was really proud of getting 3 miles in 18 minutes.
Well,
but
she's
like,
not running on that anymore, just so we're clear.
No,
She's running
but
real
clear,
gravity
like
now.
she was bragging about her run time.
Oh,
and
yeah.
so like what you're telling me is that she didn't run actually using her own body weight. She was basically being held up and she was running in midair, getting this fast
It wasn't
run time.
running for her. She was actually having to run, but it does unweight you, and it is humbling.
You can
when
drive-
So
get
she
off
was
of it.
cheating. I just want to,
No.
for everybody listening out there.
I was at 96%. So
You're optimizing.
What is, you can go all the way down to 20%.
20%. Yeah.
So that's great if you're coming back from injury to just rehab yourself.
That's right.
To
That's
get
what
to where
we
you
use it
can
for.
run. Or if you can't run ever. But most people can't afford those things in their house. I can't. They're so expensive. They're like,
They've gone up dramatically.
were
The
they
first
like
one-
50,000 or something?
Now they are.
Yeah.
The first one
Whoa.
was
So-
probably 12 years ago, and it was 32,000, I think.
I mean, treadmills in
That
general
is a
are
pretty
jacking
neat
up, too.
apparatus.
Yeah.
Get the
It's
whole
pretty
body
cool.
movement, but you don't have to have
They've
the
improved it.
stress
I
on
mean,
the
to their
knees and the
credit, it
hips
is better than the first model, but it ain't cheap.
No, they're so
That's pretty
crazy
cool. I'm glad you were able
expensive.
to
It's
use
cool.
it. Even
Yeah,
though
I
you
mean-
were cheating to get that record of yours, it's like I'm really happy for you.
You know that's BS.
I love you.
And you're jealous because you run like a 25-minute. That's no judgment that you can't beat your wife and you're a man.
And you're a man.
I married you. It's been 15 years of knowing I can't beat you. This isn't new.
All right, let's go to the fun questions. Best exercise for sciatic. So many people struggle with that. Most of this she tries seems to make it worse. Is there something that's actually something that I see so many people say they struggle with? They can't run because they have sciatic. They can't do this because they have sciatic. What would you say is the number one thing that you found in your PT that can help people that they could do at home?
It's hard. One question.
It's hard to show. Well, it's actually
hard.
the
It's
problem
not that
is
easy.
it's not that easy. It's
Yeah,
the same
that's
thing. It's
right.
like, what's your number one thing for legs? It's not. It's all about angles and
That's right.
yeah. So it's not necessarily the number one thing, and also you can't really show them. And telling somebody we'll do this and cross this and do this doesn't really work either. But is there something that they can consistently do? Is it consistently stretching? Is it consistently doing a simple move, like a simple move at home? I struggled with it for years, and it can be excruciating. Like some points, I couldn't even swing my leg forward to walk. It was so bad.
Well, and I think it depends on the definition they're using for sciatica. It's sort of like I got butt pain, goes down my leg. Everybody's like, that's sciatica.
Yeah.
That's not necessarily always the issue.
That's good to hear.
Like I got it going on right now. I mean, I just stood up
That's why
right
you had
before
to
this
stand-
thing. Yeah, my left butt is on fire, and I don't know what I did.
So that's not sciatica.
No,
Likely not.
But I know what I have going on in my back, and I got a crappy back, and I got spondylolisthesis. I got all these other things. So I think the number one thing is really getting with a professional and figuring out what is the issue instead of just labeling it sciatica. Because most of the time, that's not exactly the issue that's going on. It can be one of the symptoms of what's going on. But to me, I think it's the number one thing is just get with a professional, go to an orthopedic spine surgeon, go to a physical therapist that knows what they're doing, and figure out what is it that's causing
actually
this.
hard to find. I've been to.
Well,
I have been to
we got a place for you. We got a place for you.
But no, seriously, a good physical therapist can change your world. But like for me, when I had you work on my lower back now because that's what happens. It goes down my butt. And it can get really bad.
And by the way, this is like maintenance, right?
Yeah,
like
I just do maintenance
it'd be
to keep it from
incredibly
getting bad.
powerful to go after a injury and to recover with a specialist like you. But then, I mean, you don't have to have an event happen to go to PT.
No,
you don't. But then you get into the insurance payers. But I mean, if you just self-pay and you want to you find the right person you feel comfortable with, I mean, we can totally physical therapist.
You give up coffee and avocado toast, and you just have PT. I mean, geez, this isn't that hard.
Are always nice, but I think the thing is understanding what's going on with your back and if it's your back, because it also posterior hip pain can come from your hip joint. So you can say, I got sciatica. It's really you got a labral tear in your hip. So you really need to understand what you're dealing with first, and then you can figure out what's the thing that's most effective. Is yoga? I mean, some people love yoga. Some people yoga fires them up and it doesn't do great, and it depends on the type of yoga doing. So it's a hard question to answer without understanding what your true source of your pain is, and then you can attack it. But I like to keep back stuff very basic. My core program for people what's a good core program for me, even with the professional athletes I treat.
You work with mostly professional athletes, mostly all. Like a lot of golfers have
professional
badasses
badasses like you. But yeah, like I'm fortunate that's sort of my patient population now. Yeah.
Do you find that in many people's normal lives, they do something to aggravate whatever they call sciatica, right?
Yeah.
Like the lower back pain. Do you find that there's a common theme when people are doing things every day that they probably should be aware of to help alleviate the pain in the lower back and their butt pain and the pain going down their leg?
Back in the day when I first started practicing, I've been practicing since like 25 years I've been doing this, I think. It was, how do you lift with your legs, not lift with your back. Turns out that's not necessarily the issue. Again, there's not I wish I could give you a really quick answer.
No, I'm sure
I think a simple core program, take 10 minutes.
I think that's the key
that
right
is,
there.
So just working on your midsection.
Yeah, and it's
getting
boring.
stronger.
It's the most boring exercises ever.
We had another professional in here not too long ago when we had Dr. Kellerman who talked about it needs to be boring.
Yeah.
Your eating, it should be boring. Your workout should be boring. If you can find some fun in it, absolutely please do.
Yeah.
But the good stuff, unfortunately.
Well, and this is what I tell the athletes I work with is, here's your simple core program. Sorry, it sucks. It's boring as hell. But I think that boring is good because it can help you identify when things are not going right. Because not every day you're going to feel great, right? But if you got 4 exercises you've been doing 3 or 4 times a week, it's part of your activation, part of your warm-up, and then you're doing it one day and things just don't feel right, well, that can be informative about what you need to change for your program for that week. So I think that's why it's really important to keep it boring and keep with the exercises that you're not trying to get a huge core, right? You're not trying to see how many planks you can do in a row. You're trying to figure out, how do I keep my back healthy? So
we actually learned that from Hayden. Hayden couldn't, his back hurt every day. I think, I don't remember if he wasn't going to yet. His back hurt every day. And when we finally got his core stronger, he doesn't have any back pain anymore. Yeah. He plays soccer and his back hurt. And all right. So here's a huge one that I get all the time.
Okay.
My knees hurt. I can't do squats. And I say, well, that's actually not functional because you have to be able to sit down and you have to be able to get on a toilet. So you have to functionally be able to squat. I always say that's not an answer. You need to go to PT because if you can't squat, then you don't have a functional life.
That's right.
And so go to PT, get it fixed. I guess without knowing somebody's injury, they're always like, well, I can't squat and my knees hurt. And I was like, well, that's not okay because I think that inevitably you have to sit down and then you have to get up, which means you have to squat.
That's right. I think I can't squat well right now. I love squatting. That was one of my favorite things to do, in my bodybuilding career. whatever that was. But squatting was awesome. I mean, that was the most fun things, is get under heavy bar. And I can't do that anymore. But that doesn't mean you can't squat.
Body weight.
Body weight.
Most of them are talking about body weight even. They're talking about body weight. They can't squat body weight.
There again, I would just question, what is it that you're feeling, and why are you feeling what you're feeling? And that's where you got to get to what is the true source of the pain. Is it because you can't squat ever? Like, to your point, you're squatting every day. Come on, give me a break. I mean, you're for sure squatting. Is it uncomfortable? Well, then why is it uncomfortable? Is your hips are weak? There again, it could be a core issue, that your core is not strong enough. So then you're shifting your weight. You're putting all your pressure through your patellofemoral joint, and that's what's causing the problem. Or you could just have like crappy knees. If you got crappy knees, you just got to find a way around it.
And you were about to say you have to change the way you squat, like.
Yeah, mechanically. I mean, some people are just built to squat better than others. You have hip angles. You have their hip bony structure can be different, and so some people it's just
a lot
more
of people's knees
squat.
Buckle in.
You can have like a valgus or varus knee, and that's just
I'm a big squatter. I'll sit on the toilet for a good 30.
That's a true thing.
Can you get?
Then your legs are numb.
Your legs are all numb.
I use my legs, not my back. You know what I mean?
Your legs are all
it's core
numb.
work to make sure that my squatting is healthy every day.
But I agree with you. I mean, I think you got to figure, use TRX to unweight yourself and learn the movement patterns better.
Okay.
Get with a really good person.
And I say if you don't have that, you just hold on to a door frame. That's what I say. It's simple. Hold on to a door frame and learn how to do it correctly. A lot of people don't do them correctly, and that's where it hurts, because you're not doing it correctly too.
That's right. That's right.
And so if you can learn perfect form, and if you are doing my app and you're not understanding, you can go to a PT session too, and they can teach you basics of that. And then you're like, well, my knee still hurts there. They can help you learn to develop the muscles around your knee to help support them. Is there an injection that you recommend if someone has knee pains? I guess it also depends on what their knee pain happens to be.
I wish there was a one size fits all there, but I really like the hyaluronic acid injections that we do.
I haven't done them yet.
I've been trying to get you to do it for a long time. I'm like an avid. I go do it twice a year.
You're recommending something she's not doing?
We actually
She doesn't listen to everything I say.
Oh, baloney.
There's a few hundred things.
The number of times I've talked to her, and she's like, well, let me check with Kenny.
She checks with me, but sometimes she chooses not to listen to me. But that's okay.
You did tell her she'd never run again. I think that was.
That wasn't
No,
me.
that wasn't him. That was Dr. Moore.
Dr. Moore is the worst.
No, he's actually amazing. But
he's a realist. He likes to keep it real.
He does. Sure. He's my doctor.
You know who likes to keep it real? The guy who's calling Dr. Moore the worst. Okay, real over here. Whatever. You keep it politically correct on the left here. This is the open mic. Hey, we're gonna be right back with Kenny in a second, but we're proud to have this episode sponsored by
Addyi, Addyi. And you guys don't leave, because we'll be right back with Kenny. Okay, ladies, you've been hearing me talk about my libido, or more accurately, my lack of libido. Now let me tell you about what helps me get it back. Addyi, or flibanserin. Addyi is FDA approved and has been clinically proven to increase sexual desire in certain premenopausal women who have been bothered by low libido. I started to lose my libido in my 30s, and it feels so good to have my drive back. So if you feel like you've lost your desire, you want to get it back, stop falling for the snake oils and ask your doctor about Addyi today, or go to Addyi.com. That is ADDYI.com.
And now I get to do some house cleaning. I wanted to read something like this as fast as I can forever. Here we go. Addyi is for premenopausal women with acquired generalized hypoactive sexual desire disorder, HSDD, who have not had problems with low sexual desire in the past and who have low sexual desire no matter the type of sexual activity, the situation, or the sexual partner. The low sexual desire is troubling to them and is not due to a medical or mental health problem, problems in the relationship, or medicine or other drug use. Addyi is not for use in men or to enhance sexual performance. Your risk of severe low blood pressure and fainting is increased if you drink 1 to 2 standard alcoholic drinks close in time to your Addyi dose. Wait at least 2 hours after drinking before taking Addyi at bedtime. Your risk of severe low blood pressure and fainting is also increased if you take certain prescription, over-the-counter, or herbal medications, or have liver problems. Low blood pressure and fainting can happen when you take Addyi, even if you don't drink alcohol or take other medications. Do not take it if you are allergic to any of the ingredients in Addyi. Allergic reactions may include hives, itching, or trouble breathing. Sleepiness, sometimes serious, can occur. Common side effects include dizziness, nausea, tiredness, difficulty falling asleep or staying asleep, and dry mouth. See full PI and medication guide, including boxed warning, at Addyi.com/PI or call 844-PINK-PILL.
Ask your doctor about Addyi today, or go to Addyi.com. That is ADDYI.com, baby. With red light, that's when we got to hit on.
Yeah.
Red light. So you were the one that got me on red light, and you told me the brand to get. I don't even know how you say it, Juve.
Juve.
Yeah, that's exactly how you say it.
Oh,
Okay.
yeah. You love
I
that thing.
love red light.
Is it
I use
doing
it on
well?
my face
Or do you
and
just
knee.
like the heat?
What do you find? People are like, can you tell a difference? I was like, I do so much, so I can't say I isolate that.
Same.
So I can't say for sure that it's doing what they say it does. But what is supposed to be the purpose of red light?
Speaking out of my realm of expertise here, but it's photobiomodulation. So it's light therapy, basically. So you're using light waves to increase the metabolism in your body. It's supposed to help with whole body inflammation. Lots of things. There's some pretty good studies, not super strong studies. Speaking of Dr. Moore, he'd probably laugh at some of the research that's out on it. From my personal experience, I started red lighting probably like 8 years ago, probably. And I can tell a difference when I don't do it. I can't tell you exactly what I feel differently.
That's what I would say.
But I feel different. I don't feel as good when I do it. And I can tell you just after numerous surgeries of my wounds heals way faster with red light. Not even close.
That's
I had a
awesome.
big incision on my hip for my hip replacement, and the incision's probably 3-4 inches long, and it healed in like 8 days. I was red lighting a couple hours a day, and it
Couple hours a day. Holy smoke balls.
Yeah.
I do have a question here about red light.
Yeah.
And it was talking about red light for tennis elbow. Obviously not like a
I like it for
incision.
everything. And
Okay.
why? Because you're speeding up the metabolism. It helps with collagen, supposedly. I mean, these are not super proven, but I think the anecdotal evidence is very strong.
Okay.
I mean, I have $1 million athletes that I'm fortunate enough to work with, and it's a staple in pretty much every one of them across the board.
I really
people
wanted
I know.
my goal would be have like a couple of those like human.
I want the
tall,
You
whole
can do it.
panel.
right, but I want them like lined up on the shower.
Yeah.
To go into the shower, so you're taking the shower and just kind of like
Totally.
spinning, washing, and then there's just a flood of red light coming through
First
the shower
thing in the
door.
morning, that'd be great.
Dude, wouldn't that
I
be
know.
awesome? I want to set up like good
They
three
can
I
of
would
them
love
on our
that.
glass
Do you do
door.
red light on
Shower
your
door.
face too?
I do, but not as much.
I do it.
usually have so much other shit that hurts that I'm
Right.
my
Do you have
face
to,
is
do you have
probably
to
the
be
one.
right up on the red light, or can you
Yeah.
just be
That's another
within
one.
within the?
I think it
aura?
depends on it depends on the manufacturer and the power of the light. This is again, I'm speaking probably out of turn here a little bit, but
Yeah, quit
I
speaking.
think there's a lot of variation. It's just like anything. Some people half-ass it and make it in manufacturing. Like I put a red bulb in there, and that's your red light. It's really the amount of power
Okay.
of the light that's coming through. So you need a good company, like the one I recommended to you.
Juve is a medical grade.
It is, and they get all their research, which not super strong research, but all of their research is based on that power that they have for that. So if you're getting another red light that's not that brand, make sure that the power is at least in the ballpark.
We are happy with Juve. JOOV. If anybody's
I love mine.
I've used it.
It's
for
like the
8
highlight
years.
of my morning coffee and red light
every day, first thing in the morning.
Same.
I've been wanting
Yeah.
to use it, but she steals
I hog it.
You gotta
Sometimes my
get some
son
more.
steals it
Yeah.
because you tell him to.
I did tell
Go get your mom's.
I
I'm
probably
like,
did.
what?
That's messed up.
Yeah, sorry about that. Let's go get more. Let's go get a big panel. They have these beds now.
I
It's
wouldn't
like a
mind.
tanning bed of red lights.
We got too much to do.
that you
We got to
can get.
multitask.
Yeah.
I do. Do you
They're
wear
great.
goggles when you do it?
I don't.
I don't need. Actually,
I
the Juve
don't.
doctor, the guy that actually invented it, said
Yeah.
that you don't need to.
Yeah. Well, and there's more research coming out that on eye health being benefited from by the red light. So
Speaking of benefits from red light, do you remember a couple summers ago when people were like opening up their butts to the sun, getting that like perineum like light?
What?
Have you ever?
what are you reading?
No.
I
How
hear about
have you not heard
I
of this?
missed that study.
Dude, no, it wasn't a study. It wasn't a study. But we're talking about
think
red
it
light,
was a
and they were
study.
like
I
literally
missed
like
it too.
That's
as
awesome.
over tea kettle trying to get like sunlight into their butthole, and that was supposed to be like healthy. And so like, should I start doing that? Taking the Juve and just like
I mean, you got third floor here. He could've been just-
Sean spends too much time on social media. That's the
This was a couple
answer.
of years ago. Are you
This is
kidding?
why
You
I stay
haven't
on
heard-
social media.
This was not social
Just
media. This was literally
specifically for this.
everywhere, and it sounded absolutely ridiculous.
All right.
But do I need to shave my butthole for that?
I
Yeah,
think
shave
so
it, buddy.
to
Let's see how.
I think
Shave
so.
it and tell us how it
To get-
goes.
Yeah.
All right. What are good IT band exercise for reoccurring IT band issues for runners?
It's usually because I feel like I'm skirting but there's no clear
One
cut
size
answers,
fits all.
right? I mean, you usually have really tight IT bands, or they become problematic because something else is going on. Your IT bands is super, super strong connective tissue on the outside of your thigh, and can you really even stretch it? Probably not. It does have a muscle belly at the top called your TFL, your tensor fasciculata. That is the muscle part. Then it becomes the band part that you feel that's really strong. Can you really stretch it? No, but can you? If you get soft tissue work done on it, does it feel better? No question. I think it's a hard
Dry
thing to
needling,
do.
too.
Kneeling, I love kneeling IT bands. I think that's a really good thing, so you can hit. And are you really hitting the IT band, or are you hitting the
Kneeling?
Needling.
Dry needling.
needles.
Dry
Sticking
needling.
little needles in there.
I thought you were like literally on top of them on the table with their knee, like full body
Well,
weight.
sometimes you have to
right?
do that
Like,
with
I
IT band.
thought that's what it was.
We'll
Okay,
drop an
dry
elbow
needling.
for sure on
You've done
it.
some incredible dry needling on Erin.
But yeah, I think IT band is more one of those things is sort of like your go-to if I hurt on my
what
knee.
is that doing? Dry needling.
Do you? Oh, go for it.
Sorry.
Dry needling? Well, dry needling is more of, it's like I use it for things I can't get to with my fingers, meaning, you have a really focal needle point that you can get to a trigger point, or you can get to a really super sensitive part in the soft tissue that I can't get deep enough with my fingers, or sometimes to save my fingers, to be honest with you, after doing this for 25 years. But I
So
feel
like a
like
pinpoint needle would be the same as a good deep tissue massage. That sounds crazy.
it's complementary, I feel like. I mean, I don't feel like it's the answer. I feel like it's
You're
part
trying
of the
to just
solution.
activate a sensitive area so that it just.
That's right. You're giving another. So there's a lot of things that's happened. Probably the most cool things that happen, at least in my physical therapy world, is dry needling, and also PRP, things like that.
Love
What
it.
you're trying to do is stimulate your body's own natural healing processes. So you're
Oh.
creating an acute inflammatory response because you're putting a needle in something. You get all these nice repair chemicals that rush to the site. So you sort of reset the body's natural healing processes.
You're
and
pinpointing where the internal
without
drugs
medicine.
are going to.
And
Like your
without
naturally
medicine,
occurring
which is cool.
drugs.
That's right. That's your naturally occurring drugs.
Yeah.
That's a good way to put it, I think. But
So you did dry needling on my elbow.
Yeah.
I had golfer's elbow, right? Golfer's.
Is
And
tennis, golf? Is all
Golfers.
the
I
same?
think
golfer's
it's-
inside.
Yeah, I had
tennis is
golfer. I
outside.
had
no
golfer.
kidding.
I had golfer's elbow, and you did dry needling on that, and it feels better almost instantly. But
Yeah.
it can like move your fingers when the needles are.
Yeah,
Like
those are trigger points. So it's basically like
It's
hyperactive things. You hit a little spot and you get a little twitch response. They call it.
It's actually really cool, and it
Yeah.
fixes it quick. But it
Most
did.
of the
Weird.
time.
Yeah. But mine did come back. We eventually did. You didn't do it, but I went to Dr. Moore
Yeah.
and did PRP in my elbow.
He did
And-
something right? No, it's good to hear.
No, whatever. He's awesome. Dr. Moore, if
We'll
you're
get fired after
watching,
this.
you can beat his butt. I get it. But no, he did it, and it actually is gone. Like
Yeah.
100% gone.
PRP is a really cool thing. I don't know that we fully understand. I think it probably gets overhyped and overutilized, just like anything. But I mean, why would you not try it? I mean, you're using your own body's.
Most people
healing
don't know what
processes.
PRP is. How would you explain it?
It's platelet-rich plasma. So essentially, we draw your blood, we spin it in a centrifuge, you isolate the platelet, and you have growth factors in the platelets. The growth factors are just chemicals to how to try to restart your body's natural healing processes, and you just inject it in the spot
You
that's.
take your own blood, you
Take your own
isolate
bed.
something from your
That's
own
right,
blood,
own
and
blood,
you then
spin
put
it.
your own stuff back in you.
Yeah, so
Okay.
why? I mean, you got the risk of infection if you're sticking a needle in something, but that risk is really, really low if you got a competent person doing it.
You loved
And
it.
I loved it.
Painful,
Yeah.
but
I-
absolutely
No,
amazing.
the elbow wasn't painful.
No?
No, the
There's
foot,
some that
the
are.
heel was.
The heel sucks.
Oh my gosh,
Yeah,
the heel.
That's awful.
But it fixed it. Holy
It did.
cow.
Yeah. I mean, I am thankful, and I will
It was
forever
kind of
do
like
it.
pain,
But-
Yeah.
pain for like 20 minutes versus
Yeah.
pain for months.
Yeah,
Yeah.
totally worth it.
I'm a
I've done-
big fan. I think
Do
you
you-
should try it for
Do you
sure.
believe PRP is really good for plantar fasciitis? There's a lot of plantar
Yeah, we had
fasciitis
some plantar
questions.
fasciitis questions.
know-
Because you know what? It did fix mine. That's why I want to say
I think it-
because I had when my
Yeah.
heel pad separated, I also had plantar, and when
But
they
you
did,
had stem cells too, right?
I had stem cells too.
Yeah.
So,
So-
which one of them did it? I don't
who
know.
knows and who cares?
I did
really,
three
honestly?
rounds. I did 3 rounds of PRP,
Yeah.
1 stem cell. So I did
The
3 times.
studies are not good. So it depends on how you had a great experience with it. The literature, from my understanding of the literature, is
Not
and I haven't
there.
read every study. Is it's not. It's a really low success rate,
Oh, shoot.
and it's a super painful procedure.
I was
It
hopeful.
is.
I
And
had somebody
it's,
asking
you
about
know, and
plantar
it's-
fasciitis. She had
and
both
insurance doesn't
feet,
cover it.
surgery in both feet. She shots and stuff, and she's
Yeah.
hopefully you had like one tip that could.
That is probably if you had to rank the most stubborn and just not what you like to see on your schedule is plantar fasciitis, because it's just, I feel kind of helpless with it sometimes. I mean, sometimes I dry needle it and put stem on it, and there for a minute I thought that helped a lot. Not really. I had plantar fasciitis probably for like 15 years. And I went to one of our doctors, Dr. Willers, who's our foot and ankle surgeon, and we did Oscitron, which is like the same technology that they use to break up kidney stones. So it's shockwave therapy. So knock you out. They literally zap both of your. I had it on both feet, and it's the only thing that fixed it. It's the only thing that like got rid of my Oscitron. That's what it's called. And so I had that probably 7 years ago, and it's not even close to. I mean, sometimes I get a little bit of heel pain, but nothing like I experience daily with plantar fasciitis for literally 15 years.
Wow.
It has about an 82% success rate, and I think it's the right. I mean, that's the one. My wife just had it on her plantar fascia, and
did she have plantar too? Was that what hers? I thought hers.
Yeah, she had both. She had that, and then she had lateral foot reconstruction, so she had a big ankle surgery too. But so she just went ahead and knocked it all out. But her plantar fascia seems to be good after that Oscitron procedure. But I think it's, it's a lot of things. It's shoes. It's like, what is really the cause? And honestly, sometimes they just resolve on their own, but usually they come back, the plantar fascia issues. So,
do you find it stems a lot of times from wearing not the correct shoes and not stretching appropriately, getting too tight? Your Achilles, stretching up at your Achilles, your calves, all that kind of stuff. Make sure all that stays loose.
And I personally, I don't like walk around barefooted for people that have plantar fasciitis. I know we got a lot of barefoot people out there but I say
uncomfortable.
I say go get UFOs, the recovery slides. Wear UFOs anytime that you're not wearing your nice shoes.
Oh, I would never walk around barofoot when I had it. It hurt so bad. It's excruciating.
I agree.
If you
have ugly feet.
Well, whatever. You wanted me to make a Bunions only account because you love my Bunions so much. Don't lie.
I'm not. No, I didn't. I wanted to make money, and I feel like there's good money in Bunions. It's a niche market.
But
as far as Bunions go, those things are money.
I will say the stem cell. Maybe it was a stem cell. Maybe it's a PRP.
Yeah.
But it fixed mine instantly. Like within, I had to stay off it for a little bit, and probably a month and a half. 100% gone, and it's never come back. And that was 2020.
Before I started.
Yeah, it was 2020. And so it's been gone.
You haven't seen it it's been less than 4 years.
When did you tear your ACL?
Holy cow.
Really?
Oh man, Kenny, I thought you'd been around forever.
No, it was COVID time, wasn't it?
It was before.
It was right before.
Right after COVID, 21.
Okay.
So while you're looking up the next question, one of my favorite things to talk about, like PT in general, right? Because a lot of people have had surgeries or injuries, and they always get sent to PT in wherever city they're at.
Yeah.
And one of the things I always talk to my clients when I'm working out with them is don't PT me. And they understand what I'm talking about. But basically, you're talking about the boring exercises. You need to do them. This is the program I give you. You need to follow them through. They might seem boring. They might seem simple, but these are the things that work if you do it consistently over time. And I remember talking to a client, and she would have one thing done, and her guy would move on to another client, and she just wouldn't do it anymore while he wasn't looking. Or like, do 10 on this side, 10 on the other. And she'd do 10 on this side, he'd walk over, and then she just wouldn't do the other side. And so that's what I tell them all the time. Don't PT me. I'm going to get another weight. When I turn my back, you better keep going.
But I always tell people, like, PT exercises seem so lame and dumb. They're stupid. It's like, move this, slide here, whatever. They seem so dumb. But the biggest thing is to be consistent and do your homework. And most people don't go home and do their homework. And I feel like that's why I had so much success. Some people would say it was a fail since I broke it and tore it again. I wouldn't call it a fail at all. I feel like I've been super successful because I'm faster now than I've ever been.
Right.
And I'm running at 46. And I've been through a lot
with an awful knee.
Yeah, I mean, I have arthritis. They said like
an
85.
Have a bad knee, right?
And it hurts zero. And so I feel like it's consistency of doing your homework. And do you feel like? Yeah. Well, probably your patients are different.
Don't PT yourself.
Your patients are different because you work with mostly athletes.
I haven't always though. I mean, I've done the gamut for sure.
Trying to get people to do their homework is virtually impossible.
It is, and it's, I think that's one of the awesome things about our patient population, our practice, is we have people that want to get better.
That's
I have been in my PT career where I've had patients that Don't really, and it's incredibly frustrating. But I think that's something you got to do as a therapist and as a clinician, as a personal trainer. Is you got to get your client to believe in who you are and and that you know what you're talking about, and that they'll trust you. I mean, it's a trust thing. I think if you build a relationship, they feel like they let you down when they don't do it. And even if you have that honest discussion of like, I hadn't really been doing shit.
Do you use that line? I'm not mad. I'm just disappointed. Have you ever used that?
No, I'm pretty straightforward. I'm pretty like,
you're just mad.
Like,
you're just
mad.
I'm
like, whatever. You don't waste my time. I mean, sorry, I've been doing this a minute, and I don't have time for you to waste my time.
I'm trying to help with my line. Don't PT me.
All
so
right.
when they need to go to PT, they're going to listen.
You know, you learn early out of PT school if have eyes everywhere, and so you can kind of see like, hey, fix that, and why didn't you know you were watching? Well, yeah.
Good job.
Even if you weren't really, you can just kind of make it up.
Because you probably know they're messing up anyways.
Yeah, probably.
You know what's
go ahead and fix
wrong.
that, just so that you remember I am looking,
All right. Is it possible to regenerate cartilage in a knee?
Oh. Well, if we had that answer, we would be conducting this in Hawaii on my
We'd be really
private
rich.
home. Yeah, we would. Yeah, we'd be super rich. There's one study that I read. I think the doctor was in Kuala Lumpur, and he actually did show some articular cartilage regrowth. Don't let me quote the study. So I think there's hope, but is it widespread?
Yet.
No.
Oh, no.
If it was, it would be the biggest news going. And I think there's hope, but I'm not the expert on that. But I don't know that. I have hope because I want it to happen, right? I don't want to not to be the case where you're just stuck with an arthritic knee, and that's what you got to deal with, right? So I think there's things you can do to support it better.
I feel like Dr. Moore will say no. Collagen has changed my life because my arthritis is so bad, but yet I have no knee pain, and there's no explanation for that.
Yeah. Is it the collagen supplement? I don't know. Is it the red light? I don't know. But who cares? I mean, I think it's doing more of the right things.
I think it's a combination of everything.
That's right. I think it's doing more of the right. I was just listening to a podcast on the way up here on pain, and I there's this. I was thinking about coming talking to you guys today of how much information is out in the world now compared to when I was in graduate school. I was back in the day where you had to go look at microfiche, and you remember microfiche in the lobby in the library. I mean, I was.
She doesn't.
I tell people that now. They're like, "What the hell are you talking about?"
She doesn't. She's never set foot in a library in her life.
Well, you did. That's what I was writing a paper.
You might need to explain what a library is real quick.
Well,
I didn't spend a long time in there.
But I love research. That's what I thought I wanted to do, and so that's how you had to get it. But now there's just so much information, and
there's a lot.
What do you do? And it's overwhelming.
Which surprises me. You haven't heard about sunning your perineum.
Yeah, I haven't heard about that one.
Okay. All right, another question. Can a patient with a torn meniscus still do squats and lunges?
Oh, yeah.
Yes.
Oh, yeah. No question. I mean, it just depends on, meniscus is like this piece of cartilage that's in your knee that provides cushion, right? And that helps support your joint so you don't get an arthritic knee. And so if you get a little tear in your meniscus, it depends on where it's torn.
But a bucket tear is pretty painful.
Bucket tear is going to be a problem.
Yeah, that one I've had that. That one's pretty painful.
Yeah,
but it's an easy surgery.
Can be.
Well, it's easy if they shave it. If they repair it, it's much longer. But you
save
want
it if you can.
Yes.
Right? Yeah. So a meniscal repair is a little more. It's still a really great surgery, and usually the outcomes are really, really good on them. It's just a pain in the ass for the first 4 weeks because you can't really do that much with it because you want to protect the repair. But if you can save your meniscus.
None of my meniscus surgeries were able to repair.
Well, and it depends on what part of the meniscus you injure too, because some of it doesn't have a great blood supply, so the repair is probably not going to work. So sometimes you just have to clip it.
That keeps surprising me how much blood supply matters to any of it,
huge,
which makes sense, right? When it's actually said to me, but it's like, well, that's a long recovery because the blood doesn't go there. Like that's the only thing that's going to heal it, right?
Yeah.
Like you got to have that project.
Yeah.
Pretty neat. Pretty interesting.
Oh man, they want to know if you're single, buddy.
No, I'm not.
You know,
happily married.
His wife is freaking awesome. She's actually a PT too, and she is helping us right now design our kids' clothing line because they've got so many kids.
Erin Opria Basics is about to have a youth line.
Yeah.
How about that?
Is that breaking news? Did we
breaking news? Yeah, we haven't really. Well, we kind of talked about it a little bit on Instagram.
And guess whose kids are going to be the testers?
Oh yeah.
Not your son.
Are you kidding me?
I don't think he's going to be wearing shiny leggings.
A men's line underneath the shorts, right?
Like
it's going to be the same.
Either one of my sons. What's that?
Same thing. The running tights underneath shorts.
Under shorts.
That's
I don't know. He's very picky. He might talk like my 18-year-old. I mean, I don't know if he got an NIL deal on that deal. He probably would wear it.
All right. So we have time for one more question. How to strengthen your shoulder so push-ups don't hurt?
Cuff work, right? Rotator cuff and scapular stabilization work. So again, boring kind of exercises, but literally you can make it just part of your warm up to get your body heated up. I mean, a good cap stabilization program, once you got it down, less than 10 minutes.
So the answer for that is to go to PT, go to a good PT, get a good program, and do your homework and
keep it. And just like the core work is keep it consistent, which is boring for some people because they just
most people.
Yeah. But if you keep it consistent, then you know if your shoulder's tweaked. You know, like, hey, I'm doing my cuff exercises today. That usually doesn't hurt. That hurts today. Something's up. Then you can make a better decision on your workout, you know? So I think it's I'm very, at this point in my career, that's probably one of the things I should have done way better early in my career. And for sure when I was, in my athletic endeavors
you used to be a big bodybuilder. You're kind of dumbing it down, but come on. I mean, look at his body. You're like, well, maybe. I mean, his bicep is literally bigger than my quad.
I was a different body at one time in my life.
Wait, you were down at Santa Monica Beach Gold's Gym, right? That big Gold's...
I moved that was my dream growing up in my little tiny town in East Tennessee in the mountains was I could not wait to move to Los Angeles. That was my things. I could not wait. So I finished undergrad and I moved to LA and I lived in Venice Beach and had stayed in my car and slept in my car, a Honda Civic CRX for I stayed in the Gold's Gym used to have a deal where you could rent a parking space basically for the month and you could stay overnight. You could leave your car parked overnight. So I kind of stayed there, stayed a couple friends' couches. I actually met a guy out there that owned a tanning bed. Owned the biggest tanning bed right there in Venice. This is 92, right? So this is before, this is before you could do spray tan very, very much. And he would let me fold towels and I could sleep in a tanning bed at night and get up and fold towels and do his stuff at night.
That was your bed, the tanning bed?
For a little bit, like 1 or 2 nights a week.
Incredible.
And then I'd sleep somebody else's couch. And I was just living the bodybuilding dream for a little bit out in Venice. But
And then you went back to school.
Dude, what stories, though?
Then I went back to school. Yeah. I wasn't the only one living in my car in Venice Beach at that time.
Oh, I would say sure. Not. You know what?
There was a lot. You'd be surprised.
I wouldn't be surprised.
You probably would, because you lived out there. You know how that is.
All right, so I'm going to ask one more question because ACL, I've been through enough of them. ACL reconstruction on a 13-year-old with open growth plates. Mm-hmm. Not started her period, yes or no? Did she do it?
I'm not an orthopedic surgeon. Have we done ACLs on? Yes.
I've seen lots of young girls in there.
Yeah, but it's you gotta have the right orthopedist that can evaluate the bone, evaluate the benefits.
Is Dr. Moore the right orthopedist?
Yeah, he actually amazing. He is a badass.
Yeah. Dr. Moore, I apologize. It's an easy shot.
We love Dr. Moore.
Dr. Elrod and Dr. Moore, they're the keys to my career. So, I obviously, and I could, that's why I've stayed with them for so long because they literally are the best. I mean,
they're good.
Are there other surgeons in the country that are good? Yeah, but I feel like they're the best. And that actually make me a much better PT than I really am is because they're right there. I call
to BS them on that. You're so good.
Thank you.
I call BS. I've had several PTs, so I know a good
but
PT.
But when we call it in, when we have to go get a PRP, I can't do your PRP, correct. Right? And so we got
it's the balance of having two good people around.
You gotta have a team. You gotta have a team. And,
but I feel like with the ACL, if she doesn't do the ACL because she's so young, what's the other option? To hold off and do it when she's 16?
Well, here's my feeling. Do you have to fix ACLs? Could you go by? I mean, there's lots of people walking around without ACLs.
Yeah, but she's probably an athlete.
If you're an athlete and you got to do change of direction, you're going to accelerate arthritic changes in your knee because you got an unstable knee. And there's just no two ways about it. You can strengthen all you want. You can do all those things. But if you're going to challenge your body and change the direction and being especially a competitive athlete, you got to fix it, in my view. Now, do you have to fix that specific one? Again, you need to go consult with an orthopedic surgeon that's used to doing pediatrics with open growth plates because it's an issue. And I'm not the expert on that issue. I can take care of them once they get whatever they get done. But it's a complicated thing that you gotta get the right surgeon. Just like, you gotta get the right therapist, you gotta find the right surgeon. Luckily,
you got a good team.
I got a whole bunch of them right there where we're at.
And that's Elite is the surgery section that he works with, and then MPower is
your company
therapy.
The therapy.
That's right.
And so if you guys are in Nashville area, Elite is who I go to, which I'm super, super proud of. They have been amazing for me. MPower, of course, has changed my life. I mean, I'm not even injured, and I still go all the time because. And my
kids.
It's
fun when you come in. That's right.
You make a good point. Not being injured, I feel like I'm not represented personally in this discussion because I don't have anything wrong with me.
I've never seen you.
You know what I mean?
I haven't seen you in clinic. I don't know what's going on.
There's nothing wrong with my knees. There's nothing wrong with my shoulders. There's nothing wrong with my hips. I have a different bloodline. I'm built different.
You don't challenge it.
No, like
I love it. Stay healthy.
Yeah, right. Like, what do I do? Like, you didn't even talk about me,
Sean.
I don't have. What do you do with somebody who doesn't have problems?
You just celebrate it. Yeah. I mean, congratulations.
I do. I celebrate.
I got my own problems, so I'll just work on. That gives me more time to work on my own problems.
He's like, I'll celebrate with my.
At times I've been like, please, for the love of God, don't get hurt. Because when I go see Kenny, he's gonna be like, your wife doesn't bitch this hard. Your wife doesn't cry like a little baby when I do this.
All three of you are totally different.
Bro,
the way you approach
I do not want to go there because you're like, you're part of this family. Oh, I don't want to show you my weakness. Ugh.
Both the boys.
I'm not really a complainer. Not a pain.
Aaron's more reeling her in from like just. Don't
How would you
do
rate
that?
Our family? Going to you.
Okay, you're done. All right, you guys have been awesome. Sean, stop saying dumb stuff.
It's my job.
But this has been fun. Kenny, I truly appreciate you coming on and chatting. I'm sure there's going to be a ton of follow-up questions, so maybe we can work on another section at some point and just dive into one particular subject. Because PT is a thing I 100% believe in, and I think that a lot of you guys can use it, even if it's just one time, go in, get homework, and do it religiously at home like it's your job.
And we'll make it, doesn't always have to be boring. We make it fun.
It's never boring. It's never boring for me.
We'll make it fun in there.
But the exercises are simple and you can do them at home. That's the best thing. And do them continuously. And like I preach all the time, consistency is where the results come from. So
exactly.
Hey, you guys have the best day. And thanks for tuning in. And we'll see you next week. Bye, everybody.